Um, Hi, I'm Theresa Thompson, coming to you from the Weight Issues Network, where I'm the operations lead. I've been with the charity for about almost 3 years. Um, we love to advocate for people living with obesity because it's not a voice that's been strong. And it's because of stigma that we do get hushed quite a lot. And so we are learning to step up. And so living with obesity is something I've had most of my life. It's definitely shaped how I move through the world, not just physically, but emotionally, socially, and in the way that I'm treated. So I come today from the voice of lived experience. I'm not an expert in the science or the research related to obesity, but I can tell you how things have made me feel personally. Other people who I've met through working with Win. I think that what I wish people knew about obesity. I think I wish the most that people would understand that it's not an equation of willpower and choices or personal responsibility. Um, that there, we know now that there is research and evidence that shows that biology, environment, trauma, medications that you're on, mental health, other social determinants can really affect the way that you manage your weight, your eating, your exercise, your all the things that you're told to do, just go and, eat less and move more. And the frustration around that is you can be fighting barriers that you don't even truly understand yourself. And so I guess it gets really frustrating when people kind of reduce your lifestyle to a stereotype that just actually isn't accurate. Um, I love going to the gym and I love movement and I love exercise. And um, the barriers to that for me have been, okay, I'm going to go for a walk and someone will yell from the car and call me a name and shut me down and I go back into the house where it's safe. I've gone to a new gym and you get the assessment at the beginning and someone says, "Oh, we got to get that belly waist down, that's quite dangerous." And they're not telling you anything you don't already know. There's a whole reason I walked through that door, and it probably took me a whole lot on that day to get through the door, and just to be kind of poo-pooed the moment that you walk in doesn't inspire you, and it doesn't encourage you, and it doesn't give you the energy to throw into what you're about to do. And um, I could go on and on actually about the barriers to exercise. Other gyms I've joined and they try to push you so hard that you can't move for the next 2 weeks. And so you put off ever going back again. And so there's so many different barriers to achieving those things. Biology, when it's not even understood or acknowledged by the medical profession, when you walk into a doctor or a clinician, um, and you don't understand it yourself, it's a barrier that's kind of unspoken and not acknowledged. Stigma has probably played one of the biggest parts in my journey. And I think after speaking with so many people, so many members of the Weight Issues Network, it's such a common experience. There's people, who share stories that are just heartbreaking about the way that they've been treated, jobs they didn't get, um, the way they were teased and bullied, yes, as a child, but also as an adult. Um, and then when you go to a doctor and their code is to treat people um, with the care and bedside manner that should be well respected. Um, the stories of stigma brings shame and so much disappointment in yourself, and you can walk away and go back home again to where it's safe, and not get treated. So, for example, I went to a specialist that had nothing to do with my weight, and my weight wasn't spoken about, as it shouldn't have been, because it was not a part of my consultation that day. And then I went out to reception after my appointment and was handed a prescription. And the lady said, "Oh, the doctor wanted to give you this," and it was a prescription for pre-diabetic medication. Even the unspoken word speaks volumes. And when I later saw the letter that went back from that specialist to my doctor, and it said she needs to get her BMI under control, and that person has no idea, without asking me a simple question, they've put me in a box and said, "This is where you are, and you're not doing anything about it." And without asking me any questions, they've got no idea what I've tried, and that they just assume I want to live in this body, which, I don't really understand why anyone really does want to live in a body that's so much larger and makes life a bit difficult to move and do normal things. So it's really frustrating when that stigma comes about from people that should be respected in society. It's not motivating at all. It doesn't provide empowerment to do better in, those lifestyle changes. In fact, it's quite counterproductive. It's harmful, it's isolating, and it can stop people getting the treatment that they require. Um, I luckily more recently have started to receive some more supportive care in my weight when I sought bariatric treatment, and it was through a public health service. And it was a team of four people. There was the doctor, the nurse, the psychologist, and a physiotherapist. And every single one of them made me feel human again, empowered, and ready to take on a new part of my journey. They asked questions, they answered my questions in a way that didn't make me feel blamed, judged, or like I was wrong. And and they all talked to each other, which I really loved. And this supported environment of professionals who were very transparent in saying, "You're not going to say one thing to the psychologist that the physio isn't going to know about, or the doctor isn't going to find out about." And yes, it provided accountability, which we all know we all need when we are trying to address our body. But it also provided a support system where, I knew that if I told the psychologist something, that if she caught on to something that I missed, and she could then go to the doctor or the physio or the nurse and say, "I think Theresa might need a little bit of help with this or that." So when you see that multidisciplinary care really in action, in your own lived experience, it really shows the difference of what that can make. And it's really helped me understand my own personal story and how I've got to where I am. Um, it validates you, when a clinician actually listens and asks you questions. I remember asking the doctor, he said, "I want you to try and lose, 10 or 20 kilos if you can," which is a lot. We all know that's quite a lot before the surgery. And I said, "Okay, what if I ran out the door and went to the gym and I lost, 20 or 30 kilo? Would you still do the operation?" I was terrified that I wasn't going to get the support had I have, reached a target goal. And he said, "Of course we will. If you stop, if you, bust your hip and you can't exercise for the next 6 weeks, you're going to put weight back on because that's just the way your body works." And that validation and that acknowledgement of my fight of my whole life of having weight on was a real stepping stone to the way I see things now. And I really, really appreciated that moment where I was really heard and validated and understood. Um, so I think, we can sort of go through that as, meaningful support looks like compassion rather than judgment. It's access to evidence-based care without shame or judgment. So it's really important that systems recognize that obesity is a complex and chronic condition. It doesn't need to be a disease. It might be a disease. whatever people want to call it, but it's not a moral failing, and it is complex. And there are so many things that come into play that really affect what puts us in the position where we gain weight, and also the barriers to then being able to lose weight or treat health conditions as a result of our weight. Um, so people who ask, how can I support you? What do you need? Rather than offering unsolicited advice, which, we all get all the time. Um, and to bring it into the World Obesity Day 2026 theme, I guess when we talk about 8 billion reasons to act on obesity, we're really talking about creating a world where every single person, no matter what their size is, can access respectful, compassionate, and effective care. Um, you know, People living in a larger body tend to be very isolated and feel like a burden on society, like they're personally responsible for their situation. They feel ashamed and embarrassed. And that's because of all those unsolicited comments and the things that, even those members of society who we kind of trust to know better are treating us in a different way as well. And so I'd really like to see, people living in a larger body start to recognize that there's a lot of work going on in the background, a lot of research happening, and a lot of communities being built where our voice is heard and we're important and we're just as important and valuable as any other member of society. And that systems and environments and policies and communities all shape these health outcomes. I'd like to invite decision makers and clinicians to see themselves as a part of this solution. This is not just us. This is not just, eat less, move more, or drop the muffin, as someone, you read in the comments. And, you know, um, my story is just one of millions. And, if sharing my story helps one person feel seen or heard, um, or if one professional rethinks, how they show up and how they're responsible for treating people, then this is worth it. Um, there needs to be real collective action. And this is where we do appreciate the work of the Obesity Collective. And, the fact that the Obesity Collective values to the highest level the lived experience voice. And we're here for it.